Welcome back to Medical Monday. I'm here with Dr. Nancy Peacock from Tennessee Oncology, a breast cancer doctor. It's your chance to call in, ask any questions you might have. 615-737+ is the number to call. Want to talk a little bit about breast cancer, and then what do you worry about? What other types of cancer can spawn off this breast cancer? Where does it spread?
Well, if breast cancer recurs, it tends to come back in either localized lymph nodes or in the lung. It could come back in the bone. It could potentially come back in the brain. What we see in older women who have smaller endocrine sensitive breast cancers, those that are ER positive, PR positive, is those tend to recur in the bone a lot. And most of the time when that happens, we can treat those women for a long period of time. We may be able to treat them with other endocrine agents, other drugs that may not make them terribly sick. The hard thing is to know who's going to do well with that strategy for a long period of time and who's going to relapse pretty quickly. There are a new class or two of drugs out there that we're using in metastatic breast cancer with the endocrine agents that have been really helpful. And there are specific cellular pathway regulators that we use in conjunction with an aromatase inhibitor, one of the hormone drugs, to slow breast cancer down. And one of those has been so remarkable. It's a drug called palbociclib. It's what we call a CK4/6 inhibitor, and it's a pill. It interferes with a specific pathway that controls cytokine 4 and 6, and so it inhibits that pathway, and at the same time also inhibits the endocrine pathway. And that's hard to explain to a patient, but when you explain it to a doctor, they go, "Oh, well, of course." So these oral combinations can be difficult to give. You have to really spend a lot of time teaching your patients about them, but what's happened is that they have resulted in really long progression-free survival. So we're seeing women whose disease may stay in remission, metastatic disease may stay in remission for 24 months, whereas generally the time to first progression is 9 to 10 months. So they've been pretty remarkable in that setting, and I think we're going to see more of those agents come along in the next few years.
Let's talk to Annette. She's with us tonight. Annette, thank you for your call. What's your question tonight? Or Elizabeth, I'm sorry. Elizabeth, go ahead.
I was curious. I'm 3 years out on breast cancer myself. And when I was having my checkup in this past November, they asked me, she told me, I was asking her, who would I look for it next? What would be the sign? And she said, what it would probably be in my bones. And I was just wondering what some of the signs I need to be looking for.
Great question.
It is a great question, and I think it's something that a lot of people worry about. One thing you have to try and remember is that it's not, you're not going to miss something that's going to harm you. I think that you need to look for symptoms that last for 10 days to 2 weeks. And what I tell my patients is call for shortness of breath that lasts more than 10 days, that wasn't brought on by a cold or upper respiratory tract infection, bone pain that lasts for more than 10 days, again, that wasn't caused by trauma, by a fall, a twist, wasn't caused by your pills, because sometimes those aromatase inhibitors can make your bones hurt a lot. But a specific kind of pain, those are the sorts of things you need to look for. We're pretty good at hiding things from ourselves and saying, oh, this is nothing. But once you've had a diagnosis of breast cancer, I think you pay a lot more attention to what's going on with your body. So I would say that if those sorts of things go on for a period of time, they don't wax and wane, they don't get better and worse, they just continue to progress and get a little worse, you need to let your doctor know.
On the flip side of that, or on the front side of that, even before your first diagnosis, beyond feeling a lump, beyond having a mammogram result that comes back, what are the symptoms of breast cancer?
Yeah.
Are there any?
No, there really aren't any. Some women notice that they feel really tired, and they said, "Boy, I felt so tired," and then I got it. And that's a bad thing, because we all feel tired, right?
Yeah, exactly. That's a symptom of all women.
Right, exactly. But then they say, "Well, once it came out, I felt a lot better." So I think that's the only thing I've been able to put together after 20 years.
Wow. So it really is kind of a hidden disease in some ways.
Yeah.
You have to have that mammogram, which isn't the best test, but it's the only test.
Right, right. right now.
All right. We have another caller. Thank you for being with us tonight. Go ahead with your question.
Hello?
Hello, go ahead with your question.
All right. Me, I have breast cancer 2009. Between 2009 till 2011, take right breast. I do chemotherapy, Herceptin, radiation, everything in Santana Hospital. That's my question. Now, sometime last year, 2015, I do my mammogram, but my mammogram be okay. But I hope for this year, 2016, till now, I wait for my husband. He inside U.S. Army. He had Medicare over 65. But Social Security told me, ma'am, your age not dependent on your husband, not any insurance. Till now, I don't have any insurance. But my questions, I hope your office help me what I doing, because my mammogram 2016, if not any insurance, very, very expensive.
So it sounds like what you're asking is you don't have insurance right now, but you'd like to get
Yes, ma'am. No.
Okay, so but you want to get a mammogram for good reason. What
Yes,
can you
ma'am,
do?
for 2016?
Okay.
But for this reason, I don't have any insurance. January 28, I go by my primary doctor. I tell, but maybe he understand I don't have any insurance. Just my questions. I go to Mahari Hospital. Last year, I do my mammogram Southern Hills Medical Center.
Okay, hang on. Let's see if we can get an answer here. Are there programs out there, if you don't have insurance, you can still get a mammogram?
Yes, in fact, Kroger has been
Kroger.
Health Foods
Supermarket, yeah.
Supermarket, thank you, has been really helpful. They sponsor a program along with St. Thomas Health to get mammograms in the community for patients. I think if you look at some of the free clinics that either the city puts on, like or that St. Thomas Health has out in the community, if you went into one of those clinics, they would find a way to help you get enrolled in a program that will do a mammogram for you, and it'll be a regular mammogram. It won't be, it won't be a mammogram light. It'll be the real thing. So I would say look for those resources. We have them in the community. I would also say that Tennessee, without politicizing things too much, does have an emergency program through their TennCare program for both breast and cervical cancer. So if someone's diagnosed with breast and cervical cancer, through the state of Tennessee, you can apply and get TennCare, and you will have health care coverage for those two problems. This is a big issue. A lot of people have invested a lot of time and effort into getting these sorts of programs for women in the state, so pay attention. We may not have universal coverage yet, but we at least have coverage for these two cancers.
Okay, so good information. Perhaps we can direct her to, you said St. Thomas, perhaps Kroger, maybe the pharmacy would be a place to start. They may know where to point her in direction, something they support.
I would try.
And maybe even the health department?
Yes, or Lentz Public Health Department, any of those programs.
Okay, hopefully that's a big help. We're going to take a quick break. When we come back, we will wrap things up. Stay with us.